Well, good morning, everyone. It is my sincere and distinct pleasure to welcome you to this year's annual general meeting. I would like to begin with a land acknowledgement. A land acknowledgement is offered to recognize the enduring connection of Aboriginal peoples in their traditional territories, to recognize the history of the land that is currently shared by many peoples, and to recognize stewardship as a shared commitment of all those who reside in a territory. The practice of territory acknowledgement is itself a replication of the Aboriginal practice which predates European contact. We respectfully acknowledge the territory in which we gather as the ancestral homelands of the Beothuk and the island of Newfoundland as the ancestral homelands of the Mi'kmaq and Beothuk. We would also like to recognize the Inuit of Nunatsiavut and Nunatuakuvut and the Innu of Nitassinan and their ancestors as the original people of Labrador. We strive for a respectful relationship with all the peoples of the province as we search for a collective healing and true reconciliation and honor this beautiful land together. And today it's an anniversary and a special day to remember of the Truth and Reconciliation Commission. My name is Leslie O'Reilly, and I'm chair of the Board of Eastern Health. Again this year, we are hosting our AGM both in person and virtually. I welcome those in the room as well as those who are with us online. I would like to introduce our head table for you. To my far left is Gillian Sweeney, and Gillian is the Assistant Deputy Minister in the Department of Health and Community Services. Welcome, Gillian. Pleasure to have you here this morning, knowing that you have lots of other things on your agenda in healthcare. Next, we have Sharon Forsey. Sharon is a member of our Board of Trustees, and Sharon is also chair of our Finance and Committee. And next, very close to me, just keeps me in the know, is Ken Baird. Ken is our new CEO on an interim basis at Eastern Health. And Ken, thank you very much for your commitment to the organization, and again, welcome this morning, and you will hear from Ken a little later. I extend a warm welcome to Eastern Health employees, physicians, and volunteers. You all have the utmost gratitude for your exceptional response to another full year of challenges and opportunities. Next, I would like to thank our health foundations and auxiliaries for their continued acts of kindness and giving. This generosity has a tremendous impact on our patients, families, community, and the entire Eastern Health organization. I would also like to recognize my colleagues from our Board of Trustees who are joining us today. Eastern Health is governed by a voluntary Board of Trustees, all of whom are accomplished individuals with a wide range of background and experiences. Thank you for your guidance, passion, leadership, and devotion that you bring to your governance role. I'm going to ask the trustees if they would stand in their place and just their name, please. I really appreciate it. Want to go Marilyn first? I go from the back. Tara? Lynn? Scott? Bob? And we have others joining us online this morning. Thank you very, very much. I really appreciate it. And let's give our board a real warm welcome here. Next, I would like to acknowledge Ken Baird. Kenneth has graciously taken on the role of interim president and CEO as we transition to one healthcare authority. I'll make reference to it a little later as we go on. I would like also to welcome then, as I speak about the new health authority, David. David Diamond. Stand, David, so they'll recognize you for your future next 20 years. David Diamond. David is the new CEO, president and CEO of the new healthcare authority, and he's very busy with building a team to get the organization in place. So he's spoken so much here, I won't ask him to make any other remarks right now, but we'll get your story later. Thanks very much, David. It's a pleasure to welcome you back. You know you're always welcome, and you made such a good contribution to Eastern Health and to health in Newfoundland and Labrador. Ken has an extensive experience as a healthcare executive, and many of you know him from his former role of quality process improvement and clinical supports. Under his leadership, Eastern Health will continue to provide safe and quality care to the people we serve, and that's the directions we have outlined in our 2023 strategic plan, putting excellence into action. And I will refer to our plan a little later, and when we look at our annual report. I have worked with Ken during my time on the Board of Trustees and have found him to be an exceptional and thoughtful leader. I am confident that he has the vision and experience needed to advance healthcare while Eastern Health and our health system transit towards a single health authority. As to members of the Eastern Health executive team, your leadership has been invaluable to ensuring our patients and families across the province are receiving quality healthcare services while balancing the operational challenges and changes as we continue to persist this year out of last year. It's very difficult to put into words the contribution of our healthcare team, our executive team, the time and commitment and sincerity they give to the organization, facing huge challenges that are Canadian-wide and worldwide, and the time and effort they put into resolving or working with issues and challenges is highly commendable. I'm so proud to be part of that team. Last but not least, I welcome you as members of the public, community partners, and the media who have joined us today. Thank you very, very much. It is now my pleasure to invite Ms. Gillian Sweeney, Assistant Deputy Minister, to speak on behalf of the Department and the Government of Newfoundland and Labrador. Please join me in welcoming Gillian Sweeney.
Good morning. Board Chair Leslie O'Reilly, Board Trustees, Interim President and CEO Ken Baird, members of the leadership team, staff, physicians, members of the public and patients, as well as members of the media. I'm really delighted to be here today to bring greetings to Eastern Health's annual general meeting on behalf of the Minister of Health and Community Services. This event is a great opportunity to reflect on the past year and your many accomplishments. Of course, there have been many challenges. However, it has resulted in creative problem solving, innovative ideas, and has demonstrated what we can do when we work together. The leadership team, staff, physicians, and volunteers are to be commended for your work in the areas of access to care, quality and safety, population health, healthy workplace, and sustainability. I would like to extend a sincere and special thank you to the Eastern Health Board of Trustees. Thank you for the years of dedicated service you have provided to people in Eastern Health. Your dedication is truly honorable. Eastern Health has had many successes over the past year. Just to name a few, a memorandum of understanding between Eastern Health and the University of Ottawa Heart Institute was announced, allowing for a number of patients deemed to be suitable from Newfoundland and Labrador to travel to Ottawa for cardiac surgery. This temporary short-term strategy will help address concerns in the province with cardiac surgical backlogs, which have increased due to COVID-19, as well as the recent cyber attack. This agreement also provides for a partnership between Eastern Health and the University of Ottawa Heart Institute that will complement the work of the highly skilled team of surgeons at Eastern Health, and most importantly, support patient care by providing access to certain procedures and treatments that are not currently available in Newfoundland and Labrador. You also introduce same-day joint replacement surgeries. This will help to minimize wait times and improve access to care, as in some cases, lack of available beds for inpatient care has been a barrier to a patient receiving planned surgery. You've made significant progress in primary healthcare transformation. A collaborative team clinic was first established in the Metro St. John's region in 2020 as an initial step to address the local issue of unmet healthcare needs of residents who did not have a health home. Over the last year, 2 additional clinics have been established in Eastern Health to help the challenges we have with the increasing number of patients without a primary health care provider. Patient Connect NL was originally launched in Eastern Health in collaboration with the Newfoundland and Labrador Centre for Health Information in December of 2021. This was to support the attachment of patients to your collaborative clinics. In addition, the information on Patient Connect NL will be used to plan and improve access to primary health care in Newfoundland and Labrador, with the goal of connecting individuals to a primary care provider as soon as one becomes available in their chosen area. Budget 2022 allocated $2 million to add another 24/7 ambulance and more than 20 new permanent positions in the Eastern Health region. The extra positions will address the current peak we are seeing in activity levels. Finding ways to better meet the needs of individuals, families, and communities is important, and we would like to thank you for your hard work on these initiatives, and many others that I've not mentioned here today. As we continue to improve our healthcare system, we will build upon the work of the Health Accord to improve specific social, economic, and environmental conditions affecting all of our health. Our department is appreciative of its relationship with Eastern Health, and we look forward to continuing to work together. And so, on behalf of the Department of Health and Community Services, I would like to wish you a successful AGM and all the best in the year ahead.
Thank you very much, Jillian. Jillian has, I think, been around the circuit. She is an employee at Eastern Health, worked with Newfoundland Labrador Centre for Health Information, and she's now been elevated to the department. And Jillian, we really thank you for taking the time this morning. We know how challenging it is for government and the department to face the challenges, like as I indicated earlier, that's ahead in healthcare and present today. And I know to take the time out to be with us is there was other agenda, and for us to be with us, we really appreciate that. I was going to say I'll give you our sympathy, but I won't. But because we're all going through the same bereavement, right? It's a very tough grind, but we're all doing our best to really resolve the challenges that work with them. As many of you are aware, Eastern Health is Newfoundland's and Labrador's largest integrated regional health authority. Our organization provides a full continuum of health and community services, including public health, primary care, acute or hospital care, rehabilitative and long-term care to more than 300,000 individuals who reside within the region extending from Port Blandford, the Burin, Bonavista, the Bay, all the bays, of course, and the Conception Bay area, right through Southern Shore. It's a whole eastern section of Newfoundland, so it's quite a composite, really, of people and communities and outreach. So it's quite a challenge, really. But I think from all health authorities, our health authority I think, has a reach that they understand, and we've worked throughout that community, the broad community, in such an effective way with so many creative and innovative ideas. We're also responsible for delivering tertiary level programs across the province and services to the people of St. Pierre and Miquelon, expanding our reach to approximately 510,000 people. So our reach is much greater once you add tertiary and our reach and our contract work with St. Pierre and Miquelon. I'll reference our annual report because for those of you really interested in understanding the depth of and the challenges in healthcare and the opportunities and the progress we've made, our annual report is quite a picture. It paints quite a picture that I think you will find very, very informative. So I'll refer to that at the end because that's where the story is and the details are that I think that would really amplify some of the words I'm using this morning. We will now move to a formal part of our meeting, and that is the approval of minutes. The approval of the 2021 fiscal year AGM. At this time, I am seeking approval for the minutes of the 2021 AGM held September 29th, 2021. Do I have a mover from Carol Lang? And do I have a seconder? Bob Andrews, thank you. Moved and seconded that we adopt the minutes of 2021 AGM. On the question, all those in favor? Contrary-minded? Absentees? Absentia, I think is the correct word. Operating in absentia. Thank you very, very much. Motion is carried. I would now like to ask Ms. Sharon Forsey, on behalf of the Board Financial Committee, to give her report. Please join me in welcoming Sharon.
Thank you, Les, and good morning, everyone. Today, I'm pleased to present for adoption at this annual general meeting the financial statements for Eastern Regional Health Authority for the fiscal year ending March 31st, 2022. These financial statements have been audited by the firm of Ernst & Young LLP, and I am pleased to report that the auditors have expressed an unqualified opinion on these statements. Eastern Health has 13,462 employees and 721 physicians, of which 245 are salaried. For the fiscal year 2021-2022, Eastern Health's cash-based operating expenses were $1.702 billion, of which 77%, approximately $1.31 billion, was spent on direct patient care. The other areas of expenditure included support, administration, and research and education. A detailed breakdown of Eastern Health's finances can be found in the operating and revenues expenditure section of our annual report. During the fiscal year 21-22, Eastern Health incurred an operating cash deficit of $72.6 million, while a year-end accrual deficit of $68.4 million was realized. The financial statements are included in the annual performance report, which is available on Eastern Health's website. I would like to take this opportunity to thank the members of the Finance Committee and the Board of Trustees for their support and commitment during the year in overseeing the finances of Eastern Health, as well as thank you to Ken, our new President and CEO, his executive and staff for their work and dedication. Mr. O'Reilly, I move the adoption of the audited financial statements of Eastern Regional Health Authority for the fiscal year ended March 31st, 2022.
It's been moved to adopt financial report for 21-22. Do I have a seconder? Oh, hi, Marilyn. See you. Welcome for you came in. Thanks very much. I mean, you were a bit late, but appreciate you being here. Second by Marilyn. On the question, all those in favor?
Aye.
Contrary minded? Motion is carried.
And the final point I'd like to make is for the upcoming year, due to changes in the Auditor General's Act, the Office of the Provincial Auditor General will be auditing our financial statements. Thank you.
Thanks very much, Sharon. I appreciate your report this morning. I guess the financial report coming from the board is a real solid story, but a good story. And I think, again, I'm going to refer you and urge you to read that report, and you will see the financial picture clear as to the challenges, but also the achievements that we have worked with over the past year. And but the financials is a real interesting picture, and for any citizen, I think they should become close to understand the challenges and the cost and the operations of healthcare in the province. I really think so, because as a citizen, I really think it's important to understand that and not just grasp some of the peripheral things. But it's a startling picture, and healthcare is becoming very, very expensive. We all know, right across the world. And the question is how society will cope with it. But whether U.S., Canada, Great Britain, no matter where, the story is pretty well the same. So I think to be aware of it and be informed is really important. Thank you again, Sharon. It's you and the members of your committee who work diligently with you too, because I mean, you meet so frequently to work with Scott and his team to try to give us a good understanding and help the province understand what our challenges are. And so we can actually continue to operate on a basis that we can meet the goals and objectives, our strategic plan. And I give you credit for that, for your in-depth thinking and your understanding of finances and your team. You've built a good one. I'm just going to speak for a moment about the highlights and partnerships that, excuse me, that we have enjoyed over the past year. Eastern Health benefits from the enormous efforts of its many partners in helping to achieve its mandate and strategic priorities. I would like to take some time to share a few important highlights of partnerships for the past fiscal. While we saw many accomplishments in many parts of the organization, the second year of our strategic plan proved to be challenging due to the unprecedented privacy breach involving multiple information technology systems across the province last fall, and a fourth wave of COVID. As an organization, Eastern Health experienced unexpected service disruptions in a way we had never seen before as a result of these challenges. Because of this, it would be remiss to speak about our accomplishments without once again highlighting and thanking our compassionate and dedicated employees, physicians, volunteers, and community partners for coming together and continuing to deliver quality care to our patients, clients, and residents during this time, and for that matter, every day. These events impacted the entire province, and we will be forever grateful for the support and understanding we received during that time from within our organization and from my patients, excuse me, and clients, residents, and their families. Also this year, the province experienced a fourth COVID wave caused by Omicron variant that arrived in late December, just in time for Christmas holidays, when most people were usually spending time with their families. Although this meant further disruptions to care and services, fortunately, our experience with COVID-19 allowed us to adjust and recover faster than in previous waves. The response, setting up testing clinics, vaccine clinics, and responding to the medical needs of the COVID-19 breakout, as well as providing necessary services, was without a doubt an extraordinary place to work. And it was a major challenging piece of work. It took many hands on deck to provide the necessary care, not to mention the support behind the scenes that many people did not get to see, to ensure we were able to provide services for the fourth wave that occurred over the holiday period and extended during January. I'm emphasizing it because the endurance and having to face it for the fourth time, it was starting to burn, and it burnt people. It burnt out people. The fatigue, unless you met people every day, very difficult to imagine and hear the minds and the thoughts, but yet the commitment that was there. With that said, I continue to be amazed to the response to our ever-changing circumstances. Our staff, they continue to demonstrate an admirable commitment to excellence. To say I am proud of an organization would be a gross understatement. It is a privilege to be part of Eastern Health with so many dedicated, caring, and exceptional people. I really mean that. Even though we experienced some extraordinary circumstances in 21-22, we made important strides in healthcare in our region. Last year, Gillian referenced it, we took steps to make it easier for patients with chronic respiratory disease to access health in their communities by launching a new and innovative community-based comprehensive respiratory care program. This program provided preventative care to those who access it, and it also fosters self-management, critical, through enhanced education and supports. Services are provided by a registered respiratory therapist who is certified as a respiratory in education in collaboration with the patient's primary healthcare provider. Most importantly, this program has the potential to significantly improve health outcomes and quality of life for those living with chronic obstructive pulmonary disease and COPD and asthma. Eastern Health continues to implement its innovation strategy. As part of this, I am pleased to report that we added 4 new innovation partners as vendors of record. And to Ron Johnson and his team, a special call out, Ron. Fantastic, great achievement, fantastic team, great success. These new partners are Accenture, Allscripts, Honeywell, and Seafair Capital. In addition to this, Eastern Health also renewed 7 existing partnerships. As vendors of record, there are unique opportunities to collaborate with Eastern Health on the development of innovative solutions for patient and service improvements. And speaking of partners, I am pleased to report that BD Canada formally named Eastern Health as a BD innovation site for North America. Eastern Health will provide BD with access to a live healthcare environment to test their products and services. A real success story. The recognition is a critical piece. Eastern Health and BD will be leaders in co-designing the next generation of medical devices and solutions. As a result, patients, clients, staff, and physicians of Eastern Health will have earlier access to these innovative solutions. As innovative partners, Eastern Health and BD will work together to develop a roadmap to address the province's healthcare innovation goals. And finally, the organization continues to look for ways to deliver primary health care to individuals without a family health care provider. Big, big Canadian issue. Big Newfoundland Labrador issue. I'm excited to say that in the past year, Eastern Health opened 2 new collaborative team clinics in the metro area. These are in addition to the collaborative team clinic that opened in 2020, and Gillian made reference to it also. The clinics provide services through a team of health professionals. Patients who do not have access to primary care provider, either a family physician or a nurse practitioner, can register to be seen at one of the collaborative team clinics through the Patient Connect Newfoundland website. I would now like to introduce and welcome our President and CEO, Ken Baird. Ken, as I indicated in my earlier introduction, has been vice president with us, and Ken has a diversified and in-depth background in healthcare in the Maritimes, having worked on restructuring and the finer development of their systems. And we were delighted to welcome Ken back to Newfoundland a few years ago. And now, stepping up to provide us the leadership during this interim period, we are really pleased and honored, Ken, that you could be with us and stay in Newfoundland and support our healthcare. And now to be CEO with us, it's a real pleasure. So we will like to hear from you, your report. You just came on this summer, but I know you have a good report because you've talked to our former CEO. So thanks very, very much, Ken. Please join me in welcoming Ken.
Thank you for your kind words, Mr. O'Reilly. I've attended previous AGMs at Eastern Health since joining the organization as a member of the executive team in 2016. And it's an honor to be here today this year as the interim president and CEO for Eastern Health. During the past year, we experienced both new and ongoing challenges. The first half of the year was spent recovering from the third COVID wave, while continuing to administer first doses, second doses, booster vaccinations, and to individuals throughout Eastern region. Later in the year, we faced an unprecedented privacy breach involving multiple information technology systems across the province. While recovering from the impacts of that, we entered a fourth COVID wave with the emergence of Omicron. While it's definitely been a challenging year, it's also been a rewarding year in which our staff and physicians once again rose to the challenges, successfully delivering safe, quality care to those we serve. This past year marks the completion of the second year of our 3-year 2020 to 23 strategic plan, putting excellence into action. As we navigate through this time of change and transition towards a single provincial health authority, we continue to sustain our focus on the day-to-day work required to achieve success on our strategic commitments, while ensuring we're delivering safe, quality care to those we serve. With that said, it's my pleasure to provide you with a report on how Eastern Health performed in some of the areas identified in the strategic plan during last fiscal year, and to speak about how we're putting excellence into action throughout our programs and operations across the region. I'll first focus on the dimension of access. I'll begin by reporting on the work that we've done to improve access to care and service. Providing primary care services continues to be a priority for Eastern Health. It's typically an individual's first point of contact with the healthcare system. As part of this effort, the organization aims to increase the number of people in the Eastern Health region who have access to a primary healthcare provider. This is not a unique situation for Eastern Health, as other health authorities across the province, across the country, and globally are facing the same challenges. In addition to that are ongoing recruitment and retention issues, as well as the closure of several large clinics. The good news is that there's a lot of innovative work ongoing in the area of primary health care with the opening of 2 more collaborative care team clinics, as referenced by the board chair. I can assure you we're actively working on our goal to attach all patients to a primary health care provider, such as a family physician or a nurse practitioner. You'll hear more about that in our 3rd year of our strategic plan. Hospitalizations for conditions that can be managed in the community, such as chronic obstructive pulmonary disease, or COPD, represent an indirect measure of access to primary healthcare services. Though we continue to use virtual technologies such as remote patient monitoring to advance this work, we saw a slight increase in hospitalizations for COPD in the last year. However, the launch of our community-based comprehensive respiratory care program will make it easier for patients with COPD to access care in the community and reduce the rate of hospitalizations in the future. Eastern Health continues its efforts to respond to the demand for mental health and addiction services, helping people access the care they need when they need it. We remain committed to our focus on reducing wait times in 3 targeted service areas: child psychiatry, adult psychiatry, and child and adolescent counseling. I'm pleased to report that in child psychiatry, we've increased the percentage of patients being seen within their access target in the last year, which indicates a decrease in wait time. The percentage of patients seen within the targeted time for child and adolescent counseling remains stable, and adult psychiatry saw a slight decrease during the last fiscal year. With the challenges presented by the COVID-19 Omicron outbreak, the use of virtual technologies such as home-based telehealth allowed us to continue delivering mental health and addiction services when in-person appointments were once again challenged. We've also been doing wonderful work to ensure that our seniors stay healthy and independent at home for as long as possible. In the last fiscal year, Eastern Health increased how many seniors had annual assessments and support plans completed. By having a client-centered care plan and a comprehensive assessment of client needs, functioning, and quality of life, Eastern Health can better support clients to age gracefully in place. A decrease in length of stay and alternative levels of care days are indicators of efficient service delivery. Alternate level of care refers to patients who are in hospital even though they no longer need acute or active hospital care. High ALC rates indicate that patients are not being cared for in an ideal setting, such as their home, assisted living, or residential care. Unfortunately, competing priorities due to the privacy breach involving our information technology systems and the Omicron outbreak have impacted our work in this area, and we did see a slight increase in ALC days last year. As for length of stay, despite the same challenges, we did manage to see a slight decrease in our length of stay for acute inpatient care over the last fiscal year. This leads me into Eastern Health's next priority area, quality and safety. Quality and safety is an integral priority for Eastern Health that's consistently woven throughout the entire organization. One of the quality and safety objectives in our current strategic plan is to foster a culture of safety and reduce the risk of harm, both for patients and for staff. As part of this initiative, Eastern Health continues to monitor safety-related indicators and improve processes throughout the organization. For example, medical reconciliation is a process that supports the communication of accurate and complete medication information among healthcare providers at all points of care, with the goal of preventing adverse drug events and patient harm. Eastern Health has been working to increase medication reconciliation compliance rates for several years. I'm very pleased to report that after many years of focused work, this year we saw a 16% increase in compliance over the last fiscal year. We're also continually working to improve the patient, resident, and client experience at Eastern Health. One of the ways we do this is by partnering with clients and families to ensure their needs, values, beliefs, and preferences are respected in service delivery. Eastern Health surveys our client and family-centered advisors on an annual basis to determine whether they feel involvement is meaningful. In the last fiscal year, approximately 60% of our advisors responded positively on questions related to meaningful involvement. Results on this indicator differ from year to year as client, resident, patient, and family advisors change for various reasons. The COVID-19 pandemic also brought challenges with advisor retention and recruitment, as well as inconsistent and paused engagement practices. This was reflected in survey results. However, we will use the survey results in ongoing discussions with our advisors and staff leaders to support improvement for meaningful engagement. Another way that we address client experiences is by seeking feedback through our experience of care surveys. In the past fiscal year, the Cancer Care Program and Mental Health and Addictions Community Program were surveyed. This information will be used to help make improvements to services in these areas with respect to safety and the care environment of the two program areas. Our third dimension is population health. Eastern Health collaborates with various partners on strategic initiatives to improve population health and advance health equity in the region. Over the past year, the focused areas under population health continue to be impacted as our public health teams led the response to the COVID-19 pandemic and vaccination rollout. As a result, this shifted our population health focus towards initiatives that forged collaborations specific to the COVID-19 pandemic response. This included a vast amount of work to enable outbreak management, disease surveillance, COVID-19 testing, as well as vaccination planning and rollout. Despite this priority shift, work continued on the implementation of Eastern Health's eHealth digital innovation strategy. The goal of this strategy is to advance eHealth and digital services to improve access to health information, better serve clients and communities, and in turn, improve population health. Eastern Health continues to work on improving the physical and psychological health and safety of our employees, physicians, and volunteers as we move into our fourth dimension, the healthy workplace. Improving the health of the workplace has been particularly important over the past year as the organization navigated through disruptions and uncertainty that required our employees, physicians, volunteers to adapt to new circumstances and overcome unforeseen challenges. The additional stress and fatigue brought on this year required enhanced levels of support. To ensure employees and physicians have easy access to psychological support when and where they need it, Eastern Health continues to offer services such as Check with Eva, our peer-to-peer support, rapid response teams, team check-ins, employee and physician navigator line, and our employee family assistance programs. We strongly encourage our staff to use these resources that are available to them whenever they need to reach out for support. The work and support of these programs has been invaluable and can truly help any of our staff and physicians when they are in need. The board chair referenced the personal toll that the last 2 years has taken on staff, and this is a real issue, and organizationally we've put a lot of effort into supporting our staff. The organization continues to apply the National Standard of Canada for psychological health and safety in the workplace to promote mental health and prevent psychological harm within our workforce. In 2021, Eastern Health administered the standardized Caring for Healthcare Workers survey that measured selected factors outlined in this standard. The results of this survey showed an improvement in 2 out of the 5 factors. Specifically, we saw positive improvements in support for psychological self-care and in clarity of leadership and expectations. We'll use the results of this survey to identify additional improvements that can positively impact the health of the workplace for our valued employees, physicians, and volunteers. Finally, to focus on our sustainability as an organization, the last priority. To improve access, quality, and safety, as well as population and workplace health, the organization must be sustainable. Despite continuous efforts to monitor the operational expenditure budget and identify and address inefficiencies, Eastern Health's actual operating expenses exceeded budgeted expenses in the last fiscal year. Aside from the underlying challenges experienced by Eastern Health, such as our aging population and our large geographic area, the primary driver of increased expense variance this year was the direct and indirect impacts of COVID-19, which added significant unplanned pressure to our operational expenses. To offset some of these challenges, we continue to focus on enhancing clinical efficiencies and improving appropriateness of care. One of the areas in which we've been trying to improve is reducing the inappropriate use of antibiotics. Eastern Health was successful this year in this regard, reducing potentially inappropriate use by almost 2%. Another one of Eastern Health's objectives is to reduce its environmental impact of the organization. I'm pleased to say that Eastern Health continues to see reductions in carbon emissions and energy consumption through its city's facilities. And we continue to look at other ways and means to improve our environmental footprint. Additionally, as part of this objective, Eastern Health was successful in completing its initiative to reduce styrofoam in our rural patient food service and retail locations. We've now begun a new waste reduction initiative to increase and monitor the recycling of aluminum cans within some of our facilities. We'll continue to expand our focus on our environmental stewardship initiatives in the coming year. Lastly, we remain committed to harnessing innovation to improve patient care and to elevate Eastern Health as a leader in the Canadian health innovation sector. As we reflect on and learn from the challenges of the past 2 years, we continue to provide opportunities for innovative solutions to be developed, tested, refined, and applied across all areas of healthcare. We've made several announcements over the last 4 years related to innovation, and with every announcement, we further demonstrate how far we've come on this innovation journey and the potential that it represents for continued improvements to our healthcare system. We have great staff who are always thinking innovatively. We're harnessing their creativity to improve health services and products for the health and well-being of our patients, clients, residents, and communities. Eastern Health and its employees are building a culture of innovation and fostering research. We're working together every day to innovate, learn, and create solutions to healthcare challenges. And our innovation partnerships reinforce our commitment to providing high-quality patient care with a focus on safety and innovation. In closing, I'd like to directly thank our dedicated and skilled teams of employees, physicians, volunteers for everything they did in the past year to support our collective success. Through it all, through all the challenges, our staff, physicians, managers, volunteers across all areas of the organization worked diligently to ensure the plans were in place to continue delivering safe, high-quality care to our patients while keeping employee and physician safety at the forefront. This past year has provided many learning opportunities. I speak on behalf of the entire executive team and the Board of Trustees in extending our sincerest gratitude to our staff and physicians who faced one challenge after another. I continue to marvel at their resilience and the accomplishments that they've achieved. And I echo Mr. O'Reilly's statement when he says he is proud to be a part of this organization. It is indeed a privilege to work and stand beside so many talented and compassionate people. I'd also like to extend my gratitude to our patients, clients, and families for their understanding and patience they've given us over the last year through the many challenges we've faced. And lastly, thank you to everyone who's taken the time to be here with us today. I'd like to encourage all of you to learn about the work and the progress of Eastern Health through last fiscal year by reading our annual report, which is available on our website. Once again, thank you.
Thank you, Ken. It's a real pleasure to again welcome you and to hear you expound, I guess, the challenges and achievements that we have made in spite of the difficulties. I think you have a strong team around you. It's a leadership team that gives it all, gives their all, and we are all very proud. And I certainly endorse your commendation of them, as I indicated before. It's difficult to put it into words, really, when you see people who have very challenging jobs to deal with sickness and illness every day. They go to work, and yet you meet them, the professionalism, the integrity, and the sincerity and commitment they bring to the job. Words cannot express it. I see it, and so much that it's very touching to get that, because in times of COVID, in times of the break we had in the information tech system, I mean, there were days when people, I'm sure, all around wondering what's going to happen next, even public, but we pulled it out, and I think that's immeasurable. All of you know that the government have heard, the government has announced that they are restructuring healthcare in this province. And as part of that restructuring, which has been referenced throughout our discussions today, our chat today, is that there will be one healthcare authority for the province. And that means that the 4 RHAs now, there's Labrador, Grenfell, Western, Central, and Eastern, and Newfoundland Labrador Health Information, that our RHAs will be not operational once David and his team to get their structure and organization in place. And that's a major job, of course, with legislation and everything else that has to go into play. But I want to assure you that our board has committed that they will, and the Ministry of Education, Minister of Health has asked, that we remain in place until the new board is taking its responsibilities. So our board is committed to work with its stewardship and fiduciary care and commitment until that day arrives. And so David and his team and the Premier and the Minister and government are working to address that, I'm sure, and to ensure that the transition occurs in a smooth manner. And so that the transition is smooth, so we continue to operate until that whole organization is up and running. So that's the commitment we take. Some people have asked me, what's going to happen to the board? Well, when a new board is on, legislation's in, the old boards move on and or move whatever aside, and the new organization takes place. We are truly committed to one healthcare authority. And the second point I want to make is that over the past 2 years, Sister Elizabeth Davis and Dr. Pat Parfrey have co-chaired the Accord, Newfoundland Health Accord, which is to reimagine healthcare in Newfoundland and Labrador. And they've put out 2 reports. They've consulted for over 2 years, be sure. And they have gained tremendous insight into expectations, which are high, and commitments that Newfoundland really want to make, Newfoundland Labradorians want to make to a good, solid healthcare. But these 2 reports are now out public, and I really encourage you to familiarize yourself with the shape and the ideas and the shape and the thoughts that are really within those reports. And if people don't, then you're going to miss the boat, because that's where it's a 10-year plan. It's probably a 20-year plan. It's certainly 10 years to really to start to move on. And it's not in isolation, because it's like Port of Basque. I mean, they're up and running, the Premier are up and running and doing things, and yet Bango, I mean, Port of Basque and the what happened this week, they had to deal with it. So a lot of things under platter, but they're going to deal with this, and they want to move this and advance it as soon as possible so that we get the improvements that's set out there. It's going to be a lot of involvement for Newfoundland and Labradorians in this whole operation. It really calls for an outreach to the regions and to communities to really engage people. It's a challenge. It's a welcome, if you want to become involved. And I really encourage that, because that is the only way. And Ken mentioned population health. And yesterday, by the way, we had a seminar, which is one of 3 sessions, dealing with community leaders and people who have been involved with us over the years to really talk about population health, taking responsibility for your own health. And that's really throughout the whole report. So I encourage you to read it. It's I wouldn't say it's a challenging read. It's an interesting read, easy to read, but you also learn something about the healthcare and all the what's really in the nucleus of healthcare. And there's some people in this room I know can fully understand that. And I welcome you to do that. So inform yourself. And of course, with our report, I really want you to encourage you to read that report, because again, that's a look at healthcare in our region. Following our meeting, our executive team and our board are here. We will be around to speak to any of you who have any issues that you would like to discuss or chat with us. Any commendation or any other things you would like to talk with us, we'll be around. And we really thank you for coming out today, because it's a real opportunity for us to share. And we're all into this together. This is not you and I, as we know, that we're all into this game together. And it's not a game. We're all into this challenge together, and I think we have to work together. So we thank you for coming out and for your interest in the work that we are doing. And this concludes our formal agenda. And we want to again encourage you to stay around, but I now declare the meeting adjourned. And again, thank you very, very much for being part of it. And I would just like to close with everyone with a round of applause.